Well, hi everyone, I'm Judy Elliott and welcome again to Dalton Plastic Surgery, and we're excited to be with you today and excited, Dr. Sherrill, to spend some time with you. I know there's a lot of things happening, but thank you so much for letting us come out and being with you today.
It's great to have you back, Judy.
Well, you know, I want to talk with you about the exciting things that are happening here at Dalton Plastic Surgery, and just want to come out and let you kind of fill us in of what will be happening this year at Dalton Plastic Surgery.
Well, the newest thing that we have is called Xeomin. Xeomin is similar to Botox or Dysport. Botox is the name that everybody recognizes because it was the first neuromuscular modulator or a paralytic agent that could eliminate the wrinkles right here between your eyes. And this is the biggest procedure we do here. It's the biggest procedure in the United States and in the world. It has just overtaken any other procedures that we have. Botox was first, then Dysport came along, and then Xeomin is the latest one to come along. And for some reason, some people don't respond as well to one as to the other, and the price is fairly comparable between all three agents. And so if one doesn't work as well or one doesn't last as long, we can change to one of the other methods, and that gives a little more coverage.
So that is also, as you mentioned, for this area as well?
The Botox, Dysport, and Xeomin are mainly for around the eyes. I talk about this is the area that we use with those. When we're talking about the fillers, that's this area. Now, the fillers can be used around the eyes as well, but in general, the fillers are for the lips, they're for the nasolabial groove, the melolabial grooves, help to give a little definition to the jaw, jawline, and the cheeks.
Right. Now, do you know what if I were coming in for the treatment, would I need to come in advance, or would know when we came what to do?
Most of the time when people come in, they know what they want, and so we can do it that first visit. Some people will come in and say, I just want to know what's available. Now, if we have an 80-year-old lady or man that comes in and says, I want to get rid of these wrinkles here and here and here, those fillers are not going to touch that. They're going to work more for the younger people who don't have the deep-seated wrinkles. Of course, in all the brochures that they show, there's always a 30 or 35-year-old beautiful woman that is being shown, and you're not going to be able to duplicate that. But it is a wonderful supplement, and for someone who is older that needs a little more vibe in their lips, it does work very well. You know, even if they're 75 or 80, it does help to give some volume. It is not going to eliminate their wrinkles. I tell all of our patients, this isn't going to solve anything, but it's going to soften everything that we're doing.
Right. Now, I want to also talk with you about Mirror Dry. Tell me a little bit about that.
Well, Mirror Dry is just a wonderful product, and we're very proud to have the machine and the equipment to treat this. There are some people that just have an unbelievable amount of sweating under their arms, and they have to change their clothing multiple times throughout the day, and if they don't, it's just very embarrassing. We used to use Botox, and it still is being used to eliminate some of the sweating under the arms and even in the palms, but it's very expensive, and it's a temporary fix. The Mirror Dry is more of a permanent solution. Now, when we talk about permanent hair removal or permanent sweat removal, nothing is permanent. It is more of a reduction, but it can make a massive difference. And with the Mirror Dry, we try to make it a single treatment. When we first got the machine, we actually numbed the underarms, and the arms are shaved before we initiate that. The numbing does not hurt to speak of at all. A lot of us here in the office have had this done. I've had it done. But it's a very dilute solution. And then we take our electrode that we put on there, and it has a vacuum that actually pulls the hair bearing and the glands that give the bad odor and so forth in there, and it treats it with microwave energy. And there's a heating process, then it cools down, then they move down a little bit, do it again. And so there's multiple treatments that are done. Well, now we're also treating it in a vertical direction as well as a horizontal direction, so you're getting twice the energy. And for this next month, we're actually giving a special on it where it's normally $1,975, reducing that $500, so it's $1,475 for the treatment. Now when it is done, there will be a few days you feel like you're a muscle builder and your arms are kind of out a little bit. For the first day, we like to use ice packs under the arms, and then usually by the second or third day, it's not mandatory, but a lot of people do it because it feels good.
Right. Also, I know I'm just kind of hitting different highlights that's happening here, but you've also added an additional person here to help. Tell me about that.
We have added Courtney Griffin Johnston to our office. She is from Chatsworth, and I've known Courtney and her family for a long time. She was a nurse for many years, worked in the ICU, and she came to work with me as her last rotation in the PA program, and I hadn't realized that she had gone on to school, and so she was telling us what she was doing, and she, you know, fits in very well here, and everyone seemed to get along, and I said, well, you might consider us, see how you like it, because we're really swamped and we can't take in new Medicare right now, and so I said, you have to like surgery, and you have to like doing things like skin cancer and those types of treatments. She said, I love the surgical part of it. So
That's great.
Courtney joined us about 4 months ago. And
Right.
when people come to work here, it is a lifetime commitment. So we
It's part of the
expect to
family.
have her here a long time.
Right.
Her husband is a medical student, and he's in Sewanee, but he is here most of the time, and likes this area, and so we expect him to stay somewhere close by.
That's
as
wonderful.
Well. Yeah.
So now you're able to take even more patients, is what you're
Yes,
saying.
we were. Prior to Courtney coming, people were having to wait 3 to 4 months to get an appointment, and if you have something that really has you scared and you're afraid that it's going to spread, the good news is that most of the things that we deal with have 100% survivals. Your skin cancers, your basal cell, squamous cell, they have very high survival rates even after years of growth. And most people that have melanoma have outstanding prognoses. They do very well. But if you think you have something that's bad and you want to get in to see the doctor and you're told that that's 3 to 4 months away, people go, I could be dead by then. Well, they're not going to be. But this way, Courtney can see them within just a matter of weeks at least and help allay their fears.
Great. Well, we look forward to meeting and talking with Courtney. So we'll be back with you just in a moment. But thank you for talking with us. And well, it's going to be a pleasure, I know, to talk with Courtney.
I know you'll love talking with Courtney. Yes.
Well, we are now talking with Courtney Griffin Johnston, and certainly welcome to Dalton Plastic Surgery. It's so exciting to have you on board here.
Thank you. I'm very excited to be here. I'm from Chatsworth, and I moved away for several years and was very happy to come back and be around family and work with such a wonderful staff.
Right. And I know Dr. Sherrill is so proud to have you aboard and the team here. Tell me a little bit about some of the things that you're going to be helping or in doing here with the patients.
So most of the office things, Dr. Sherrill was very backed up, and it takes several months to get an appointment. So I'm just kind of helping lessen the load. A lot of skin cancers, helping with removing those, really any skin lesion concerns that you see, cysts. I'm also doing injectables, fillers, Botox, Dysport, now Zeman. I can do spider veins and even cosmetic consults. Pretty much any office thing I can help with and do those things.
My goodness, that really helps with newer patients coming in or people who need to get in a little bit more quicker with you here on board.
Right. Yeah, and Dr. Sherrill had to stop taking some newer patients, and so it just helps with allowing more people to be able to be seen. So
that's wonderful. Well, tell me a little bit about you and your background. I know you said you were from Chatsworth.
I am. I grew up in Chatsworth. I graduated from Murray County High School. I went to undergrad in Statesboro at Georgia Southern University and got a bachelor's in science and nursing. I worked in the ICU and ER for a couple of years before deciding to go back to PA school, and I went to Medical University of South Carolina in Charleston.
Oh my goodness!
Yeah,
wow. Well, I know you're proud to be back working in your home community and in Chatsworth and Dalton and the surrounding community. To have you here, what a great asset it is for Dalton Plastic Surgery. So tell me a little bit about now a little bit more. You talked about some of the things that you'll be helping with. I know you said with the skin rash or concerns that people might have with their skin.
Yeah, mainly lesions. You know, anything that you just see kind of come up that you're not sure about, whether it is a new mole, a cyst that comes up, really just any abnormal thing you see on the skin and you're concerned about, then I can see you for it.
Great, because a lot of people are very concerned if something comes up suddenly and they don't really know what to do, but they don't want to have to wait for months and months and months to be seen. Now with your own boards, you can get in a lot quicker and have those seen about.
Yes.
Now you mentioned also fillers, and I know Dr. Sherrill mentioned that a little bit earlier on the first part of this interview here. Tell me a little bit about what all you're doing with that in the lips. And a lot of women want, a little fuller lips.
Yeah, so lips have always been one of the most painful things, but people want pretty big, nice lips. And so now a soft filled catheter is being used, tipped catheter, and you make a little numbing right here in the side and just go underneath the skin with the catheter. And so instead of having 10 sticks around the lips, it's just one per side, and you can get all here and around the lips with just that soft filled catheter. People were rating pain on a scale of 1 to 10, a 10 out of a 10, and now people are saying a 1 to 2 with
My
using
goodness, out of a
catheter.
10?
Yes, out of a 10.
My goodness. Now, a question a lot of women may have about this: can you go back to work? Can you? I mean,
oh, yes.
What's the downtime
Definitely.
to this?
Before, there was a lot more bruising with using the needles, and so now there's no downtime at all. We just say the day of, no working out, getting sweaty, but there's no downtime. You can go back to work the next day. There's hardly any bruising to speak of. So
right, I would imagine that makes a lot of difference in the look here and the appearance right through here.
It does, and it doesn't, like Dr. Sherrill said, erase everything, but it definitely softens it up, and it looks really good.
Right. Now, how long does the procedure usually take in once you get back into
Once
your
you
office?
get back and everything's in the room, 5 minutes. It's very quick. So you'll probably be here for the whole time, about 15 minutes.
Right. How long does it normally last? I know it probably varies on different people.
It varies on product, but typically we can say about 6 to 8 months with the typical fillers that we use.
But that's a long time when you think about 6 or 8 months to have the lines that are softer and the fuller lips.
It is, and sometimes it lasts
almost
longer.
a year.
Right.
Really,
we had a patient this past week. There was one she was in and wondering the last time she was here, and I looked it up, and it was actually 9 months. So it really just depends. Sometimes it can last longer.
Right. Now, before our time is up, kind of just give me an overview again. What all how you will be helping with the patients here. What all you'll be doing.
Okay. So seeing patients for skin concerns. Removing skin cancers, lesions, cysts, that kind of thing, moles, any really unwanted skin problems, and then doing Botox, fillers, spider veins, and I can help with cosmetic consults as well too.
Wow, you got your plate full, but we're happy you're here.
I'm happy to be here.
Thank you so much for
Thank
spending
you.
some time with us. Congratulations and welcome to Dalton Plastic Surgery.
Thank you, I appreciate it.
All right, and thank you for being with us here. Until next time, I'm Judy Elliott. We hope you have a great day. We'll see you next time.
To advertise your business on TV, contact Elliott Media at 706-529-4237.